Have you seen your popular YouTuber lately with a bunny face?
What's up, Doc? You're despicable.
I mean, lip lift or that celebrity news anchor? You know exactly what I mean. Comment below if you do, because they now have not just a bunny face, but we call the whistle deformity. Here is another look at it in case you don't know what I mean.
Okay, quickest video update on my eye lift and lip lift. My eyes are healing amazingly. My only concern with my lips is I cannot close my mouth yet. So this is my resting face. Still teeth. So I've got a lot of questions because I don't want to, like, as cute as bunnies are, I don't want to fucking look like one for the rest of my life.
And you can't watch them anymore, so you just listen to them, kind of like a podcast. Because once you see it, you can't unsee that. And it can take a year to improve, because that YouTuber, she'll tell you, don't worry, I'll look normal and talk normal in a year. A year? Yes, you may not have heard of the whistle deformity before, but that's the bunny look where the mouth doesn't really close all the way. And once the skin is gone, it's gone. What normal person can wait a year to look half normal again? Don't worry, I'm going to give you some more natural solutions today as well, because I always do. Because 99% of you, you don't want surgery or you can't afford surgery. It's outrageously expensive these days. So if you're noticing the distance from the nose to the top of the lip elongating, very, very common. Then there's the scar issue. Look here, you can see the lip lift before and after, and you can see it lifts the center of the lip. But if you look closely, there's the scar above that puffed up lip, below the nose. That's what we're talking about when we talk about scars. You think it's uncommon? Look here, look at this one. She's showing it to you. In case you weren't able to read or can't see on the screen what her text said, it said, someone just messaged me saying my lip lift scar looked like I had a cleft lip birth deformity. Here you can see it with a special camera that shows wrinkles in the yellow. So yes, they're textured in, as you can see from that. This close up with the yellow in the lines. Now, why does a scar look like that? Because naturally, the sutures are under tension when you get a lip lift. So the suture's under tension and they leave that scars, especially where the sutures were, the stitches. The sad part, look at her age. Please notice this about the videos. Some of these gals getting it done, they look 20 or 30 years old maximum. As we'll talk about, the scar can actually drop over time, because by 60, the scar could be in the middle of the lip to the nose, right here in the middle. That's kind of exaggerated, not in the middle, but it clearly can drop because this region, it normally elongates over time. You get bony remodeling of the maxilla and involution of that bone, loss of collagen, and of course the face naturally sags down, so the scar droops with it. More on the scar in a bit, but here's Katie Price, former glamour model, sharing her experience at age 48, fresh after getting it done, so you can see.
Hey guys, yes, before you start, I know what I look like. Yesterday, I was in Brussels and I had all of the scar tissue taken out of my lips. So they're really swollen at the moment. And, so last night, luckily I had my CVD.
Why are so many being done? Money, yes. People making it, influencers, YouTubers. Greed, yes. Of course, providers want to do more of these. It's a relatively short procedure and they're about $8,000 at least. But the worst part here, all of these trends go together. What do I mean? Well, the larger lip filler trend. Remember around 2019, lip fillers took off during that time. You remember everyone stuck inside looking at the faces on Zoom? And there was a launch of a very famous lip filler that I was involved in, and we didn't think that this was going to even go. Why are people going to do it? They're wearing masks. It was the most successful launch ever, lip filler, despite people wearing masks. Watch this. This is what I mean. The trends go together.
It is. You gonna choose me, baby. It is. Or you can lose.
She said, everyone hating my scar, but... And here's the key from her caption. You might not be able to read it on the screen there, but here's what it said. Here's the justification for all of this. the scars, and that whistle deformity, it's this. She said, "This is how big my top lip looks without filler." She doesn't care about the scar. She doesn't care about that it might drop down over time. It's about the lip size. And yes, the lip lift often will enlarge the lips, and big lips are still in, despite the hate you all give them. But now you know why even 25-year-olds are doing this procedure. It's not just for distance, and it's nuts. And yes, before you go on to watch this, big lips can indeed shorten that distance. So if you're thinking, and I'm going to go through a bunch of treatments after this, just fill my lips, it will shorten the distance. Yes, that can be part of it, but check this out. I see it time and time again in practice and even around the globe. People want that distance shorter, so they go for a little bit of lip filler, get more and more, and then they get, of course, the sausage lips to shorten the distance. And for that last girl who just got the lip lift solely for lip size, until, the scar descends. I'll show you later, you can hide the scar up in the nose because I know that's what you're all thinking. Why put the scar down so low when you can hide it in the nose? I'll go through that. Or alternatively, you can even make the incisions along the upper lip border. Watch this.
Oh God. All right, so this is what we call a direct lip lift. You make a cut like right above the lip and then flip the mucosa outwards, so you create a bigger lip. This patient already has a bullhorn lip because he already has a scar right under the nose.
I'll show you in a minute, but he said the patient already has a bullhorn lip lift. So she already had the lip lift done traditional style, the most common one.
I never do the direct lip lift because the scar will become better than what you see right now because it still has the stitches in, but it will never become like totally invisible. It can also give you some issues with how you use your lips and your mouth.
So you'll have a scar along the lip if you do that. This person, it's very normal. You get one done and you want a little bit more. And also, he said something key, how you use your mouth. We talk about expression all the time. I'm going to show you more. Now, do these people know that they get botched? Or do they think it's normal? Let's look.
That I get botched. This scar is part of the deal that I said yes to.
So it's part of the deal. Now, like all of my videos, I provide easy navigation below. You'll see the chapters down there, so you can skip around because your time is valuable. But for those seeing this distance here, the top of the lip to the bottom of the nose elongate, it's common. You'll want to watch everything in this video until the end. But for those of you with short attention spans, I'll start by saying this. Don't judge a lip lift from a before and after photo. You can see on the left, the distance between the bottom of the nose to the top of the lip is longer than we might like. And then, of course, you have to look at the lower lip to the chin distance because that plays a role too. When one elongates, the other can. If the lower distance from the bottom lip to the chin is short, then you don't want a longer upper lip area specifically. But if this distance from the lower lip to the chin is longer, you can then accept, quote unquote, more distance from the top of the lip to the bottom of the nose. So it all plays a proportional ratio that we look at, and the human eye calculates this. More on that later, but this after looks good here, right? You see at rest, but then, I guess we forgot that faces move. Or at least they should move. I know a lot of us paralyze them, but look what happens when she smiles, right? You have to take into consideration gums, gummy smile, but also the lip lifts too much. She doesn't have the whistle deformity at rest. Or does she? Because there's natural static movement when people are at rest where they move it a little bit. Just like vertical lip lines, barcode lips are caused when people, they sit there, especially women, purse the lips, move a little bit, and that causes lines. So there's static movement in the muscles at all time, but in a totally non-movement picture on the left, she obviously looks good. With movement, another story. That's what makes this all difficult. Now, why do I say she all the time and not he, or the YouTuber female and not necessarily the male? I'll tell you exactly why females get it in a minute, but the simplest option for men, here's one thing right here. Well, that's a robust stash, but you know, a lot of men that come in and they complain of that distance, I tell them, just grow a mustache. Or if they come in and they don't have a good jawline, why not grow a beard and then contour it with the hair? It's the cheapest, most natural solution, and they do. So what exactly is a lip lift? For anyone who doesn't know what a lip lift is, let's look. The most common technique is the bullhorn lip lift. Skin is removed directly beneath the nose. I did say removed, gone forever. Yes, tossed away. The goal? It's simple, to shorten the distance between the nose to the upper lip. You can see here the surgical markings. Once again, very, very sad. This is a very young person, but we see it more and more. Now, this is the sexy look. Study this. Look at the lip curl at the vermilion border here. But then, of course, a little is good. This person had a little bit of filler to lift that up. That looks nice. Look at the side profile. But more then should be better, right? No, look here. She added more like so many people. It's human nature to do so. Please be careful. Now let's look at a few inexpensive treatments you asked me to cover here today. But before I do, I want you to think about one thing, and then I'll tell you what I also use in clinic for this. But have you ever thought about why do we despise that distance elongating anyway? In other words, why do we even care about this distance elongating and getting bigger as we age? Have you ever thought about it? Why it bothers us? Why it distracts us? Why it looks unattractive? I want you to think about that, and I'm going to answer it after we look at these. There's a reason. What about face exercises? You see here, she has a routine, a specific one. This is a lip lift exercise routine, spreading the lips apart, lifting up, trying to lift the corners of the mouth. Do exercises work? I wish they did, but they're not going to do much to actually change the distance. Let's look at this. Here you can see another one. Now, this is interesting because I'm going to tell you about this later, but she had her fingers on the nasal ala at the edge of the mouth. That is an important area, and we'll discuss that in a minute. Now, wait till you see this shocker. So she glued it up there. I've actually seen this done before. People do it. I don't recommend it. It can work if you really are doing videos or you need it short term. But the problem is, of course, you're gluing the skin. And we do use super glue to close wounds. However, as you can imagine, you can get reactions. It can remove skin. It's not a long-term solution. But that is one I thought you should see. And this one, can you hear it? Yeah, that is the plasma pen or the fibroblast pen. That is little burns, and you can buy these for $40 on Amazon. Very dangerous. What happens here? Hyperpigmentation. It doesn't contract the skin, but as you'll see, look at this pattern. This will tell you all about where you might be going and who is still doing this. 10 years later after it came out. Look at this. Look at that pattern. Anyone that tries to tattoo your skin off by burning it, run away. But that's the plasma pen or fibroblast pen that you may get talked into. Many bad side effects.
So I know that you're bored and you're thinking like, maybe I should dye my hair. Maybe I should get bangs. Maybe I should get a lip flip. Don't get a lip flip because it's so fucking weird. Like, ha 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 ha. I look so crazy, like this is me trying to smile, smiling.
So that's with Botox, Dysport, Latibo, Xeomin, whichever one you choose. It's 6 units around the edge of the mouth. I do a lot of that. Just about everyone's going to get that done. But if you use too much, you can't smile right. It doesn't really shorten the distance per se, but it stops the muscle from working in a way that makes it look like the edge of the lip is flipped up, a little bit like lipstick might do, like overdrawing the lipstick, or like using makeup at that vermilion border. So that is with neuromodulator, and that's why I changed the movement. But of course, as you know, the bunny rabbit look, so does the surgery, right? It does do a good job at preventing you from pursing and does do a great job to prevent lip lines, especially if you don't want to do filler, PRF, or add volume above the lip. Of course, skin products like Volufiline are more cost effective and long-term can work good to add a little bit of volume there. But check this out. Did you see what it said? Me $8,000 later. So men do get it done. And you guys mentioned to me a YouTuber, some YouTube males that get it done that you've seen in the comment section.
Tell me if you want it, fig one, my girl. When you gonna give me because your body ain't tight, still making me want it. When you gonna
So makeup, and I'll be honest, this is what I'm going to recommend most people. It works well. If you're happy with the makeup look, whatever you guys do, I don't know, but a lot of people overdraw. It can look good. Even pencil above. Comment below exactly what you do. I'm no makeup artist. But if you're happy with makeup and it can avoid you from getting surgery, fillers, or neuromodulator toxin, be happy.
You're going to have a scar. Okay, everybody scars differently. This is mine. And here is my scar with makeup on.
So you see there, makeup is good. And even after, you're going to need to wear makeup anyway because you're going to want to hide the scar.
You have to try these 3 acupressure points for a natural lip lift. You can use your finger or an acupressure tool, apply a medium pressure.
Acupressure, I don't think it's working.
Lip lift is becoming a very popular procedure to shorten the upper lip when it's too long. The usual technique is to put the incision under the nose all along, like the horn of a bull. Most of the time it heals fine, but sometimes it doesn't heal that good. This is one of the reasons why I use a different technique. My incision, as it starts, it goes inside the nose, then come out and goes inside the nose again and come out. In other words, half the incision is hidden inside the nose. This way, if the scar is not ideal, it doesn't show as much.
So I told you I would cover that earlier in the video. And the problem with that people don't like, it's a great option, but the thing that people don't like about it is if you look at your nose, there's a natural ridge there just inside the nose, and you'll lose that. So that's the problem with that method, although it's a solution to the scar, because if things drop down, it's already in the nose, you have a lot more leeway. Just so you guys can see there, that's what it looks like at 6 months, because you're wondering, how much makeup would I need?
Before surgery. One week after. 2 weeks after. 1 year after surgery.
So you can see there, they can look good. Like I thought she had a pretty good outcome. Once again, it's a very young person and she didn't need much to begin with. You could see she had makeup and a little bit of blur in the after picture at the end, but that's the evolution of what the scar might look like. And sometimes people aren't very happy with the result. Now, a lot of you are going to say, well, Rajani, I'm going to go overseas. It's $8,000. I'll go get it for $1,000. A viable option. Let's check this out.
I got a facelift and lip lift in Istanbul at 28 years of age, and here is day 3. It's the morning after surgery, the change in my dressings, and as you can see, I'm completely out for the count. I look like I've been dragged out of the vaults from Area 51. I couldn't even open my eyes at this point. I don't think I've ever been this swollen in my life.
So if you go away, just be mindful. You can see here, they're swelling. You got to stay somewhere for a few weeks. That's the one thing. Often they'll put you up as part of the deal, but keep in mind this procedure, you're going to be down and out. As I said before, a year till it looks normal for some, 6 months, but definitely the first few weeks, you get quite a bit of swelling. You can see there, that's what you might look like. Be prepared, but a lot of people do go overseas. Now, to answer that yearning question, why do we even care about that distance as humans? Simple. There are 2 reasons. Number 1, the youth Q theory. That means a youthful face has more upper tooth show, more vermilion display, a shorter philtrum, and fuller lips. A longer philtrum moves away from those features, so people perceive it as less youthful. And there's a second reason, something called neoteny, or baby face traits. Many attractive facial features are actually juvenile traits. So think about it. Larger eyes. The female eye is by nature wider open than a male, which has frontal bossing of the bone and narrower eyes. Fuller lips. Younger has fuller lips. We lose lip volume from the age of 21, 22. A smaller nose. Our nose grows as we age, smaller says younger, and a shorter mid-face. The concertina effect. We see this in Asia surgery all the time. The factories that are producing faces, the baby face. So what are some alternatives to surgery? Now, before you let somebody remove the skin from the center of your face, consider these. I'll run through them, but just know I have detailed videos on all of these on my playlists on my channel if you need a deeper dive into any one. And yes, send my videos to your aesthetic injector to help explain if needed. Number one, and this is most commonly done, a Botox lip flip. Plus, so not alone, but with strategic filler. You'll need both combined in most cases. Think adding to the philtrum. That's the line that goes from each side of the nose to the lip and down. And it goes to the vermilion border where we actually fill that area too, just with a tiny bit of filler. Botox at the vermilion too is done in about 6 units. Plus, here it is, a lot of people don't talk about this, nasal tip Botox for many people. Number 2, support around the base of the nose, the nasal ala here. Why? The maxilla typically involutes. Think PLLA or Sculptra now. It's even approved on the bone for use right there. And before you ask about PDLA, that's Juvelook. Juvelook we see and use a lot in Korea. That's added to non-cross-linked hyaluronic acid. That product is more for skin glow. Sculptra is more structural, more of a lifter, more robust. So you want to go for something like PLLA or Sculptra there. You can add in the nasal ala hyaluronic acid fillers or even something permanent like a Bellafill implant. The problem is that the artery, the facial artery that comes up, it's high risk and you could occlude that artery. It's rare, but it happens, so be mindful. Number 3 is threads in select patients. Smooth and twist style to build collagen, to bring this up, to build up this region. A true thread expert can even finagle small barb threads that I see in Asia, a little more than in this country now, but they're made to lift and promote collagen. And it's much easier, I will say, to find that procedure in Asia than in USA, but it can be done. I've done several. Now, number 4, only in some people, skin tightening with RF radiofrequency monopolar like Xtherma or combined with laser resurfacing. Well, what's that going to do? That's what you're going to ask. Well, it makes the area look youthful by adding glow, removing barcode lip lines, and reducing the kind of ruddy appearance of the skin that happens from moving, talking, and eating. This can actually go a long way because the perioral area, the area around the mouth, is no longer then the focal point where the lines, wrinkles, and distraction is. Instead of the eye being pulled toward the texture around the mouth, the viewer's attention shifts back to your more youthful features away from that distance. The eyes, the cheek, the facial balance, and overall expression are seen more than this zone. So lasers and radiofrequency. And sometimes doing nothing at all, because not every long philtrum needs surgery. And once the skin's gone, there's no going back. Now, who should think twice? Well, 5 times about getting the surgery. People with a history of poor scarring, keloid formation, a significant gummy smile to begin with, lip incompetence, excessive tooth show already, very prominent front teeth, because I showed you the rabbit look, thin skin with high scar visibility. So you want to have good healing skin if you're going to do it. And of course, as always, people with unrealistic expectations and people who are too young. And yeah, anyone considering a procedure solely because they saw it on social media, that's a bad reason. What happens with age? The procedure that looked perfect at 35 may look very different at 50 or 60 or 70. That's something very few before and after photos actually show. Now, you're going to want to watch my other videos on lip flips, fillers, threads, and facial balancing before making a decision that could change the way your face moves forever, you're going to want to watch this video all about an amazing new treatment for jowls, and one down here on the bubble face you'll need to know about if you're using growth factors.